Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing clinical application of Vasa, and in that regards we have completed the first two lines of the shlok of Vasa. The third line starts with Shwasakasa Jwara Chardi Meha Kushtha Kshayapaha. Now first we will take the Shwasa Vyadhi. We have discussed this Shwas Vyadhi before, but I will repeat it. There is increase of Kledak Kapha in Amashay, there is Sanchay of Kledak Kapha, then Prakop, Prasar goes to the Pranavasotas, there is obstruction of the Pranavasotas by this Kapha, and that's why, because of that obstruction, there is no proper oxygen supply during one breathing because the Shwas is not completed normally. So patient has to breathe more, and that's what Shwasa Vruddhi Lakshan is seen, and we term it as Shwasa Vyadhi. All the Rasavirupag, Pitta Kashaya, Katushir, Laguriksha are excellent Kafagna except Shita Virya, but all other Rasavirupag or Rasavipag Guna are Kafagna, and hence Vasa is the best medicine in Shwasa Vyadhi. To balance the Shitavirya, again Koshna Jala is the good Anupan, Vasa Kwat is another good Anupan. Now, what is the Samprapti? That there is a Kledak curve which has increased and occupied the Pranava Srotas. So, to reduce this obstruction by kapha and make the path clear, which kalpana will be better choice than churna or kvata? It is asavarishta kalpana, because of asavarishta, in there is a sukshmatva in that particular kalp. So Vasagasav, there are many Adusa kalpa like Arishta kalpana available in the market. So I will suggest, or I will use Vasa in the form of Asava or Arishta form in such a case of Tamakha Shwas. Of course, as I told you, Churna is also recommended with Koshna Jala, excellent Kafagna. Vasa Ghana is also recommended because Ghana, again because of Ushna Virya or Agni Sanskar, it becomes more potent to reduce the Kapha. So Vasa Churna with Koshna Jala, Vasa Kwat, Vasa Ghana, Vasa Kaso, Vasa in by many ways. Vasa is a base drug in the case of Shwas Vyadhi. Now this information is okay, general, all of you know. What is the important thing? That Tamak Shwas is generally a Kulaja Vyadhi, we know first thing, and it is a known, patients are known that the person is suffering from Tamak Shwas and he is getting problem in every rainy season. Now, of rainy season comes, the patient starts the Shwasa Lecture, and you give Vasa, nothing wrong in that. But what is the peculiarity of Ayurvedic science? That's Swasthasya Swasthya Rakshana. So, if a patient is known case of Tamak Shwas and he is going to be problematic in the rainy season, what is the choice to prevent this Tamak Shwas by using Vasa? So this is the main thing what we can add in our practice. Now what is going to happen? Sanchay, Prakop, Rasa, Sthana, Samshraya, and then Vyakti and Bhed of that, and where the Shwas Vyadhi is seen, Vyakta. So if you give Vasa in the Sanchaya Avastha only, it will prevent the further processes, or at least it will reduce the intensity of the disease in the forthcoming rainy season. Hence, I will recommend that if you start this Vasa Dravya in the month of May, it will act throughout that 1 month, and hence in the rainy season, which is going in the forthcoming rainy season, the Sanchay, Prakop, Prasar, all Avastha will be in control, and either Tamak Shwas will be prevented also, or intensity of the Tamak Shwas will be much less, and hence to give the medicine. See, Swasthya Swasthya doesn't mean only Dinacharya or only Rutucharya. It includes such type of yukti or planning of the treatment, that how you can prevent the known disease also. So start Vasa now. At what time you have to start? 1 May, 10 May, 15 May, April, whatever is your choice, because patient is in front of you, and hence if you plan the treatment accordingly, you will get a much good results, and patient will be comfortable throughout the rainy season. Just like we started this before rainy season, continue the same throughout the rainy season, so that all the dosha prakop will be in control. So this is about the Shwasa Vyadhi and its Vasa is used in the Shwasa Vyadhi. Next is Kasa Vyadhi. Again, underline, if a dry cough is there, Vataja Kas, don't use Vasa, it is Vata Krut by all means. I have seen many mistakes done in the practice by Vaidyavarga, that Vasa Pransutas give in any avastha or any disease. It is nothing like that. So Vatajakas, I will avoid in the patients of Vatajakas. If you feel there is Vatavrako but some congestion, then use it in the form of Ushna Jala or Vasavaleha, which will reduce the Vatavrako by its Ushna Jala or Avaleha Kalpana, because of Prakshap Dravya in the Avaleha. Pittajakas, I have not seen in my practice, and I have discussed why Pittajakas is rare in my previous lectures. You can go through it. If someone finds Pittajakas or Asuribakar Pittashamak, so Vasa is useful by any way. Kaphajakas, just like Tamakashwas, it is an excellent Kaphagna, so you can use Vasa, Churna, Ghana, Kwatha, Asavarishta Kalpana in the Kaphajakas also. Sorry. Then next is Jvara. Now by Tiktarasa it is Amapachak. So in Jvara Vyadhi, as there is Samata, you will find that it is Ampachak. Pitta Shamak, so Jvara is the Vyadhi of Pitta dosh mainly. So this is another plus point of the Vasa. It is again a very much useful dravya in the Kapha Jajwar or Vata Kapha Jajwar, where there is dominance of Kapha dosh. Again, if you have to use it for the Amapachan, Ushna Virya Vasa Gana, Ushna Jala or Vasa Gana like Kalpana, which will balance the Shita Guda, should be administered. Swasa, Kasa, Jvara, Chardi. Now, in Chardi, again, you have to think of the by two ways. Whether you have to use it as a Vamak Dravya, that if there is Dosha Klesha, and if Dosha Gati is triggered, the whole Shodha will be there in the form of Chardi and patient will be relieved. So, this is the Shodhan way of Chikitsa. Or next is Shaman Chikitsa. Vasa is of Tiktarasa, so if you want to make Vaman and add trigger to the Doshagati, you can use Vasa in the form of Kvath and it will induce the Vaman. Or another simple way, as what we said in Krishna, we avoided the Vasa taste or rasa of Vasa and its samparka with the oral cavity, because it will increase Trishna because of Ruksha Guna, etc. Here you want that Tikta Rasa to be acted as a trigger for vomiting. So just give Vasa Churna, keep it in mouth. Tikta Rasa itself is Aruchikara. That Tikta Rasa and will produce Aruchi and it will trigger or induce the Dosha Klesha and it will be Shodhan by Chardi. So if you want a Shodhan chicken, Vasa used to be used as a Shodhan, give the Churna in the mouth and Tiktaras will do the further things. If you want to use Shitavirya of Vasa or Ruksha Guna and have a Shaman Chikitsa, then again use Vasa in the form of Ghana or in the form of tablet or in the form of capsule. If you want a Shaman Chikitsa, if you use Churna, it will again trigger the chardi because of tikta rasa. So same dravya can be used for the shodhan chikitsa, and the way will be give the churna, keep it in mouth. Same dravya can be used for shaman chikitsa. What is the indication or precaution? Avoid the taste of tikta rasa, give in the form of tablet or vasa ghana or in the form of capsule, and then so that that vasa will go directly inside the amashay. So this is the clinical application of vasa, or this is the clinical dravya kund which helps you in your practice and treat the same disease, same dravya by same dravya, but in totally different logical way. Thank you very much.